therapeutic action of different classes of drugs. Now we are discussing the therapeutic action of a few important classes of drugs. The therapeutic action of antacids. Overproduction of acid in the stomach causes irritation and pain and even peptic ulcers. Until 1970, only treatment for acidity was administration of antacids such as sodium hydrogen carbonate or a mixture of aluminium and magnesium hydroxide. Excessive hydrogen carbonate can make the stomach alkaline and trigger the production of even more acid. Metal hydroxides are better alternatives because of being insoluble. These do not increase the pH above neutrality. These treatments control only the symptoms and not the causes. The therapeutic action of antihistamines. Histamine stimulates the secretion of pepsin and hydrochloric acid in the stomach. The drug cimetidine tegamet prevents the interaction of histamine with the receptors present in the stomach wall. This results in release of lesser acid. Histamine is a potent vasodilator. It contracts the smooth muscles in the bronchi and gut and relaxes other muscles. It is responsible for the nasal congestion associated with common cold and allergic response to pollen. Synthetic drugs, bromophenramine, dimetapp, and terfenadine, seldane, acts as antihistamines. They interfere with the natural action of histamine by competing with histamine for binding sites. Some important drugs are shown. The therapeutic action of neurologically active drugs. Tranquilizers and analgesics are neurologically active drugs. These affect the message transfer mechanism from nerve to receptor. We are now studying about tranquilizers. It is used for the treatment of stress and mild or even severe mental diseases. It relieves anxiety, stress, irritability, or excitement by inducing a sense of well-being. Some tranquilizers, namely chlorodisperoxide and meprobamate, are relatively mild tranquilizers suitable for relieving tensions. Equinyl is used in controlling depression and hypertension. Some tranquilizers are shown. Derivatives of barbituric acid, viz. Veronal, amityl, nembutyl, luminal, and seconal constitute an important class of tranquilizers. These derivatives are called barbiturates. Barbiturates are hypnotic, that is, sleep-producing agents. Some other substances used as tranquilizers are Valium and serotonin. Some other tranquilizers substances are shown. Antidepressant drugs. Noradrenaline is one of the neurotransmitters that plays a role in mood changes. If the level of noradrenaline is low, then the signal sending activity becomes low and the person suffers from depression. In such situations, antidepressant drugs are required. These drugs inhibit the enzymes which catalyze the degradation of noradrenaline. If the enzyme is inhibited, this important neurotransmitter is slowly metabolized and can activate its receptor for longer periods of time, thus counteracting the effect of depression. Ironizid and phenelzine are two such drugs which are shown. Now we are studying about analgesics. Analgesics reduce or abolish pain without causing impairment of consciousness, mental confusion, incoordination, or paralysis, or some other disturbance of nervous system. Analgesics are classified as follows: non-narcotic, non-addictive analgesics, narcotic drugs. Now let us study about non-narcotic, non-addictive analgesics. Aspirin and paracetamol belong to the class of non-narcotic analgesics. Aspirin inhibits the synthesis of chemicals known as prostaglandins which stimulate inflammation in the tissue and cause pain. These drugs are effective in relieving skeletal pain such as that due to arthritis, reducing fever, antipyretic, preventing platelet coagulation. Because of its anti-blood clotting action, aspirin finds use in prevention of heart attacks. Now let us study about narcotic drugs. Morphine and many of its homologs, when administered in medicinal doses, relieve pain and produce sleep. In poisonous doses, these produce stupor, coma, convulsion, and ultimately death. Morphine narcotics are sometimes referred to as opiates since they are obtained from the opium poppy. These analgesics are chiefly used for the relief of postoperative pain, cardiac pain, and pains of terminal cancer and in childbirth. The therapeutic action of anti-fertility drugs. Rising population is posing many problems to the society. Anti-fertility drugs are used in the direction of family planning. Birth control pills essentially contain a mixture of synthetic estrogen and progesterone derivatives, both of which are hormones. Progesterone suppresses ovulation. Synthetic progesterone derivatives are more potent than progesterone. Norethindrone is an example of synthetic progesterone derivative most widely used as anti-fertility drug. The estrogen derivative, which is used in combination with progesterone derivative, is ethinyl estradiol novestrol. Norethindrone and novestrol are shown.